is we're going to be recording lectures for my new program. So it's called Level Up Psych Library. So basically, I'm creating a library for mental health resources and mental health information for patients to be able to access. And it's different from my other program because that one's specifically for providers. So these are the common questions and information that patients need to know. So this is what I'm creating those lectures for. So yeah, I think let's just get started. Okay, so here's what you should know about Seroquel or Quetiapine. So this is what we call in psychiatry an atypical antipsychotic. And so this is something that we will commonly use as psychiatrists and psych providers for mood stabilization, for sleep, for anxiety, and for psychotic symptoms. So it's used for schizophrenia, it's used for bipolar disorder, it's used for major depressive disorder. These are the things that it's FDA approved for, but just remember that doesn't mean that we can't use it for other things. So we also use it in clinical practice for generalized anxiety, insomnia, PTSD, and OCD sometimes as well too. And so the reason that I personally like Seroquel a lot is because of its various dosage ranges. So your provider may put you on, let's say, like a dose of 25 to 100 milligrams. This is mainly used for sleep and anxiety benefits. And so that's due to its antihistamine effects at a medium dose. So this is where we start to get more effects with serotonin and with norepinephrine. And so this is what we use for depression, typically around 150 to 300 milligrams. So for example, I might put a patient on this for depression augmentation at this dose, or I might put a patient on, like 300 milligrams or something, like for BPD, bipolar or borderline personality treatment. And then when we get to the higher doses, like 400 to 800 milligrams per day, that's when we start to get into the antipsychotic range. So this is where it starts affecting dopamine strongly, and this is mainly used for bipolar treatment and schizophrenia treatment. So so it takes a different amount of time to work depending on what we're treating. So for sleep, like you often notice the effect within a couple of days. It's pretty quick. That's because of the antihistamine benefits. For mood stabilization, that can take usually about 1 to 2 weeks to start noticing a benefit. And for depression or psychosis, that can take a little bit longer. So about 4 to 6 weeks. So generally, because it takes time to titrate the dose, right? Let's say if I need to get you on 400 milligrams, I won't be able to just get you there right away. Usually I have to titrate you upward. So some side effects that you may notice while being on Seroquel are sedation, dizziness, dry mouth, constipation, weight gain, and increased appetite. So some of the biggest ones, so sedation, it's a very sedating med. That's why your doc will probably give it to you at nighttime, and that's when I give it to patients at nighttime, is for that sedation. Sometimes I'll have patients on this like 2 to 3 times a day if I want more general mood coverage during the day, but the biggest dose is almost always going to be at nighttime. Another big one is weight gain and increased appetite. So these are very common with Seroquel. So you definitely need to be mindful of this as well too. So it's one of the biggest downsides with Seroquel specifically. Long-term side effects, right? So that's where you can get metabolic changes, like weight gain, increased cholesterol, or blood sugar, right? So that's why your doctor or your provider will check cholesterol, they'll check blood sugar, like at least once a year. To make sure that it's not getting too out of hand. Tardive dyskinesia, something to be aware of. It's very rare with this medication, but just something to know. Seroquel is one of the least likely to ever cause this, but basically this is when you have muscle movements that don't go away. Essentially, it's like your jaw might clench a little bit, or your arms might be moving a little bit, or like lip smacking can happen, right? Those are the most common ones, but this is a very rare thing with Seroquel. Low blood pressure. This one's a little bit more common, so it can cause some, like as I mentioned, dizziness over here. That's because it blocks some of the blood pressure receptors. So basically, instead of like causing your blood vessels to constrict, it can cause them to dilate a bit, and that can cause low blood pressure. And there's a rare risk of neuroleptic malignant syndrome, but it's very, very rare. So, which this basically is when you get overheated from the medication, you feel very hot, uh, blood pressure can spike. How are you? Yeah, I'm good. I'm good. Yeah, so basically, I'm recording lectures for my coaching program. This one's directed more towards patients, and yeah, that's what it's meant for. Basically, like a mental health library. We're talking about Seroquel. Yeah, so basically here's a diagram. This is a rare thing, but like some confusion, diaphoresis, sialorrhea, tachycardia, heart rate increase, I mean salivation, right? Basically it's like your autonomic system gets out of whack, but this is a very rare thing, but it can happen with antipsychotics. So things to talk to your doc about is, okay, using the lowest dose possible, right? So sometimes, right, the higher dose you increase, the more chance of weight gain. So you may not need as high of a dose. So just ask them. But at the same time, you don't want to be on too low of a dose either, because you want to get that benefit. Asking about monitoring for weight and metabolic changes. So this is very key too, right? Ask like what symptoms are we targeting with this med. This is very important because oftentimes patients can get put on this med or other meds and not know why they're on it. So you should definitely call your doctor right away if you have confusion or drowsiness, if you start having the uncontrollable muscle movements, if you start experiencing fever or sweating, and if you start having any kind of harm thoughts or like significant mood changes that aren't normal in your case. So just some frequently asked questions. So, can you take it just for sleep? So you can. It's off-label use. Some docs do prefer it. The downside is that it can still cause weight gain and a little bit of dizziness. So it's not recommended for every patient who needs a sleeping med. But I like this med, especially if I also want some mood control benefits too. So let's say if you have depression or something, or you have a lot of mood lability, ups and downs, and I want to get your mood more stable. That's when I would use Seroquel. It's not addictive, so that's nice. But your body can get used to the sedative effects. Weight gain, that's the biggest thing to be aware of, honestly, with this. So I'll have a separate video on how to deal with medication weight gain, but definitely monitor for appetite and cravings. If you feel groggy in the morning, generally you'd either want to take it earlier in the evening or ask your doc about adjusting the dose. So that's the key, right? Maybe you just need a lower dose. Is XR better than IR? So there's an extended release. So that's better for more mood symptoms, like if you want mood control during the day. But the immediate release is better if I want something more sedating or if I want something to hit a little bit harder. Like let's say if I'm treating you for mania or psychosis, then I want to have that like hard hitting hit. Or if I want like multiple doses throughout the day, sometimes some patients prefer that. And can you drink alcohol on it? So it's not recommended for this one because they're both depressants, right? So they both cause sedation, They both can dilate blood pressure, so that can be very dangerous. You could bottom out very easily. And plus, since Seroquel is dosed mainly at night, which is the time that most people drink alcohol, that's why this is a risky one to drink alcohol with. How can I get alprazolam prescribed to me? I wouldn't try to seek out that medication directly. It definitely has its cons, but it can be helpful for the right patient for anxiety. I would ask more about anxiety treatment in general. Hey, I love you, brother. Nice, man. Love you too. Appreciate it. Hydroxyzine. I like hydroxyzine. Yeah. That sounds like a terrible combo. Alprazolam, grapefruit juice, and alcohol. That sounds miserable, my friend. I would not recommend. Okay, here's what you should know about Lexapro or Escitalopram. So this is an SSRI. So basically, this helps to increase serotonin in your brain, and so it's a med that we use frequently for depression and anxiety. So it's approved FDA wise, but for major depressive disorder, for generalized anxiety disorder. But we also use it for panic disorder, OCD, social anxiety, PMDD, and PTSD. And FDA approval just means that the drug company submitted a study to get an approval. And then once they got the approval, they didn't submit for any other studies to get approval for it. But like other studies, non-company sponsored, have still found it to be helpful for other things. So how long does it take to work? So you might feel some improvement in a couple weeks, like 1 to 2 weeks. That's when you're supposed to get, let's say, about 10 to 20% improvement. Like you might sleep better or you might have less irritability. But the full benefit takes about 4 to 6 weeks and sometimes longer if you're not on the right dose. So don't panic if you don't feel better right away. Like that's normal. Think of it more like a gradual change and a gradual titration up. So, in terms of side effects, generally, these are the most common ones. So, nausea, headache, drowsiness, and insomnia. These happen in the first couple weeks. Feeling more anxious. This can happen. Sometimes, like the medication can be a little bit activating, and the increased serotonin can cause some, like the GI side effects, which in turn can make people more anxious, as well as some of those serotonin changes. But it should stabilize within the first month. So there's some side effects that can stick around, right? So lower sex drive. So just need to be cognizant of that. You don't want to psych yourself out either. Sometimes patients will think that just because they know it's a side effect, they'll psych themselves out of it. And where it just could be like a mental thing, right? So you just need to be aware of that. And same thing with the orgasm too. But like it's definitely a real thing. So you and your doctor can best judge that. And also weight gain too. So not usually early on. Lexapro tends to be more weight neutral, but it can happen over time. So while I was talking about anxiety after starting it, right? So they activate certain brain receptors and it usually fades away too. Usually, I would recommend just doing it slower or starting even at a lower dose. So, for example, patients typically start this at 5 to 10 milligrams. It comes in a 5 milligram tablet as well as a 10 milligram tablet. So, right, if you start noticing any side effects, I would recommend starting on the lower end, like say 5 milligrams. And even if that's too much, you can split the 5 milligrams into 2.5 and just start really slow. And the typical dose is about 10 to 20 milligrams. So, it's not like more is better with all these meds. It's the right dose for you. That's what really makes the difference. What is the right dose for you? So, do you have to take it forever? No. the way I think about medications, it's like imagine you're stuck at the bottom of a well, and meds are a ladder that descends to help you climb up. But then once you climb up, you don't need the ladder anymore. So there's many people who take it for about 6 to 12 months. They feel better. They make other lifestyle changes. The stressors in their life get better, and then you can taper off slowly too. But you don't want to stop this one cold turkey or miss doses, because that can cause withdrawal symptoms. So you definitely want to do this slowly. So so talk to your doctor, right? So this is where knowing about medication can help, right? So you could say like, hey, can we start at 5 milligrams and go up slowly, right? If let's say if they want to start you at 10, you can ask them about weight gain. You can discuss the side effects with them, right? How long should you wait before adjusting? What should we do instead? You can give you a threshold for side effects too. Some patients they're more tolerant of side effects and they want to go a little bit quicker, whereas others are more hesitant and they'd rather go slower, right? So it just depends on where you are at, and you can discuss this with your doc as well. But you definitely want to call your doc right away and discuss it if you start noticing worsening of harm thoughts, right? Or like significant mood swings. There is some thought that these medications, especially for people under 25, can cause thoughts that weren't really there. Usually they might go away, but you still just want to be aware of it. If there's any kind of significant restlessness or agitation that wasn't new, and this is not just for like, an hour or two, but this is like a sustained effect that you notice, like let's say for at least a day that it lasts, or any kind of sweating, tremors, or confusion. You want to be aware of this stuff as well too, especially if it's uncontrollable, right? It's not just like a little bit. So can you drink alcohol while on Lexapro? So, like, technically, yes, you can. It doesn't interact with the same receptor as alcohol, and it's not a depressant as well. It doesn't slow down your respiratory drive. It doesn't affect your blood pressure. So, it's generally safe in that regard. But of course, it's ideally you wouldn't, right? But I understand everyone. We're all human beings here, right? And everyone's gonna do their own thing. So just remember that it can worsen depression and anxiety, cause withdrawal, cause hangover, and increase sedation too, right? So if you do decide to partake, just definitely be moderate with it and then just watch how you feel. When to take it, in the morning or at night, either is fine, right? Some people get tired from it, other people get more agitated or restless. So the most important thing is consistency, just taking it at the same time. Can it cause weight gain? So it can. It tends to be more neutral. Like it can cause a little bit, but it's not nearly as bad as some of the others. Uh, but just something to be aware of, right? So you want to monitor your appetite and your activity levels too to try to counteract this. You can take it with birth control. Luckily, there's no problems and interactions there. If you miss a dose, you want to take it as soon as you remember, right? Don't necessarily double up, right? Like this one, the withdrawal is not too bad. It tends to have a longer half-life. So if you miss one dose, it's not like in most cases you won't really feel it, unlike some other medications. But you don't want to be missing multiple days in a row, because that's when the withdrawal can start kicking in. And if you feel better, can you stop taking it? No, definitely don't do that. Many patients do that and then they end up withdrawing or getting in worse situations. So and they kind of zigzag a lot, so definitely don't do that. You want to taper this med off slowly. What common neurological agents sensitize you to hallucinogens? I don't really understand what you're asking. Are you trying to just get inebriated? Is pregabalin good for anxiety? Yeah, it is. Yeah, we use it off label, but yeah, it is. It's not generally first line, but I've had patients use it before with good results. Okay, here's what you got to know about Wellbutrin or Bupropion. So this is what we consider an NDRI, so norepinephrine dopamine reuptake inhibitor. So this means it works differently than SSRIs or SNRIs. So it helps boost energy, motivation, and focus. So thus, this makes it more an antidepressant that's more stimulating instead of calming. So that's really key because I would give it to a patient who has more low energy. So FDA approval is for major depressive disorder, seasonal affective disorder, and then also for smoking cessation. There's a formulation called Zyban that's used, but we also use it frequently for ADHD, for sexual side effects, for low energy, fatigue, or low motivation, and for emotional eating or binge eating. Typically because stimulants will reduce appetite, so that's the reason why. And think of this med like a mini stimulant. Like it's not like a full-on stimulant like Adderall is, but it's kind of like a mini stimulant that has some mood boosting benefits. Uh, yeah. So, the reason that's so unique is it's because it doesn't cause weight gain, right? And can actually help you with weight loss. It can also improve libido, so it can improve through the dopamine, so that's really helpful. It can help focus and drive, so with ADHD symptoms. It can help with emotional flatness or lack of motivation, so this can sometimes happen with SSRIs. And so it's also great as either a solo med or we can combo it with SSRIs too. For example, Lexapro and Wellbutrin or any of the others as well. Uh, so common side effects to be aware of. So insomnia, this is one of the biggest ones, right? Because it's so stimulating. So, this is why we typically dose it in the mornings. Uh, Anxiety or jitteriness, this is a very common one too. Dry mouth or headache, sweating can happen, and then irritability too, especially if the dose is too high. Stimulants are very known for irritability. Think about the stimulant like think about a stimulant like uh, think about it like coffee, right? Or caffeine. If you have too much caffeine, you get kind of jittery and irritated. That's what it's for. Hey, Sienna's? Let's freaking go. Yeah. So, but the side effects to be aware of are the serious ones are seizure risk. So it's rare, but at higher doses, or if people have a seizure history or eating disorders, you definitely want to be aware of that. Sudden mood swings, agitation, or impulsivity. So especially if you have bipolar disorder, you got to be cognizant of those as well, too. But the seizure risk is a thing, especially if you get higher than the max dose, or if there's any kind of OD on this medication, then that's definitely a big thing. Or if it's stacked with other meds that may promote seizure history, right? So you can take this medication if you have it. If you have seizures, you just have to make sure that your seizures are controlled and you don't go too high on the dose here. So generally, the most common one we use is Wellbutrin XL. So generally, you'll go from 150 to 300 milligrams once a day. You can go 450 max. So you can do that. Wellbutrin SR, this is a sustained release one. So this is usually 150 milligrams once or twice a day. This one generally, so I work in a prison, so this is where we use this one more frequently. Or, if the XL sometimes can be a little bit too much. So that's where the splitting it up, the dose can be beneficial. And so when do you take it? Usually you take it once in the morning. Yeah, and the max of this is usually about 400 milligrams per day. Usually you take it once in the morning. The XL, the SR, you would take let's say once in the morning and once in the afternoon, not close to bedtime. You can take it with food if it upsets your stomach, so that can be helpful. And yeah, so basically I would use Wellbutrin. I would give it to a patient who has low energy if they have brain fog or they struggle with motivation, like that would be the type of patient who would benefit on it. I would give it to you if you're worried about sexual side effects or weight gain. If you have ADHD or depression, then I would give this to you. Or if you feel flat on an SSRI, then this can be a good fit as well. So the people that should be cautious on this is anyone who has a seizure disorder. So if you have any kind of history of an ED, you want to be careful because this reduces appetite. If you have a ton of anxiety that's unmanaged, this can worsen that. And if there's bipolar disorder, we do use this to treat bipolar depression, but only in conjunction with an antipsychotic or a mood stabilizer. So, things that you can talk to your doctor, right? You could say, I've lost motivation. Is Wellbutrin a good fit? Can we use this to balance side effects of my SSRI, right? You've heard this helps with energy and libido, right? What dose should you start with? What should I watch out for, right? So now you're coming in as an informed patient, right? An informed consumer, and not just kind of like receiving whatever's thrown at you. And so this way it's more of a collaboration. You get to weigh in on your treatment. So overall, right, just recognize it's energizing, weight neutral. It's not for everyone, but if you're the right type of person for it, then it can definitely be a life-changing thing. So don't be afraid to ask about it, especially if you tried other stuff that didn't fit. And so this is one I prescribe very frequently. There's nothing else like it. So you might definitely receive this recommendation to take this if you are the right candidate for it. I'm on Auvelity for major depression. It has changed my life. Yeah. Auvelity contains Wellbutrin, so that's a reason why. We were talking about Wellbutrin. Now we're going to go into SSRI versus Wellbutrin. Okay, so SSRIs versus Wellbutrin, which one should we choose for you? So this is basically, they both have similar goals, but they work differently. So here's how to decide which one may be the better choice for you. So these are both antidepressants, and they both can help with anxiety and depression. Actually, I'm just going to redo this one. Okay, so an SSRI versus Wellbutrin, which one's right for you? So they both have the same goal, but they work on using different pathways. So here's how you can decide which one might be a better fit for you. So they're both antidepressants. They both can help with depression, right? They're both used as first line options, meaning that, if you come into the doc for the first time, then they could prescribe either one for you. And there's not one that's better per se, but there might be one that's better fit for you. So an SSRI, this boosts serotonin. And so we typically use this for depression, generalized anxiety, panic attacks, OCD, and social anxiety. So notice the anxiety component here of SSRIs, right? So think of serotonin as more calming, chilling out, emotionally stabilizing. So a lot of people who have anxiety, they ruminate a lot, they feel over emotionally overwhelmed, OCD, intrusive thoughts, right? That's the kind of person who SSRIs can really help. And then it also can help for depression because people, like, if they have low moods, it can help stabilize them, make them feel more neutral and chill rather than just like either agitated or really like low feeling. So it helps reduce anxiety and panic, emotional regulation, really good for overthinkers, can help people with sleep, and generally it tends to be well tolerated. Um, Side effects of SSRIs are weight gain, usually mild, I'll say even moderate for some, but it's more like a longer term thing. Decreased libido or sexual side effects, that's definitely a thing. Fatigue or emotional blunting. It can increase anxiety actually in the first 2 weeks before improving. Withdrawal. So you definitely want to be cognizant of that, right? So there definitely is some withdrawal that can happen with them. With most, I'll say except Prozac slash fluoxetine, but we'll get to that in that specific section. Um, it's a good fit for people who have high anxiety, those who feel overwhelmed, emotionally sensitive, if they're stuck in a lot of negative thought loops, and people who really just need help calming down their nervous system. So that's what it's a good fit for. Now, contrast it with Wellbutrin or Bupropion. So this is better for this is a norepinephrine and dopamine reuptake inhibitor. So basically, it helps boost norepinephrine and dopamine rather than serotonin. So this helps with motivation, energy, and focus. So that's the main things that this targets. So it's used for depression, just like SSRIs, but also used for ADHD, smoking cessation, and sexual side effects too. And it's more activating. So it's really good for people who feel flat and unmotivated. So nice things about Wellbutrin. So no sexual side effects, no weight gain. In fact, weight loss or appetite suppression, increase in energy, drive, and focus, and also can co-treat ADHD symptoms. So that's helpful as well too. Uh, but common Wellbutrin side effects are insomnia or jitteriness, headache or dry mouth, increase in anxiety, right? Just because it's so activating, like caffeine, and some rare risk of seizures as well too. So usually with people who have a history of them, or if they have any kind of ED. So it's a good fit for people who have low energy, brain fog, lack of motivation, if they have sexual side effects, if they have ADHD and depression, and people who are trying to lose weight and stop smoking. So that's the main difference between an SSRI and Wellbutrin. So can you take both together? So you can, yes. So many psychs will combine an SSRI plus Wellbutrin to balance out the two and to help with treatment-resistant depression. It's very common and it's effective, and I've done this plenty of times as well. So things to talk to your doc, right? So if you feel low energy and motivated, would Wellbutrin help with that? If you say if you're really anxious, is Lexapro, uh, or is an SSRI a better place to start? Can we combine the two if one doesn't fully work on its own, right? What side effects should I be watching out for? So see, now here you're really coming in as an informed consumer for this thought. So, just a final thought, they're both SSRIs and Wellbutrin. They're both powerful, but they just work differently. So think of SSRIs as more calming, emotional stabilizer, but Wellbutrin's more energizing and motivational. So it just depends. The right choice for you just depends on what are the biggest problems that you are facing. Okay, perfect. So that was an SSRI versus Wellbutrin video. When you're gonna jog on the treadmill again? Probably later tonight I'll do some treadmilling. Right now I'm recording vid. So basically I have a new coaching program, and it's actually for like I got this idea from hopping on live all the time. It's because people ask like, a lot of med questions, but then like you guys aren't providers, right? You're patients and you're wanting to know. So I created a new program. It's called Level Up Psych Library, and basically it's like Netflix except for mental health. So if you have a question on any medication that you're taking, if you have a question on side effects, if you have a question on psych diagnoses, right? This is the program for you, where basically you can hop in and basically search the entire library of mental health videos that I'm making for this program, and decide which is the right one for you, right? And like find that. So we have that, like basically a library of videos, and then also a community too, where you can discuss, your symptoms and discuss things with other people, get other people's experiences. And I'm also doing a weekly or a bi-weekly Q&A too, where you can ask me like the questions in more detail, and then I'll record a video response actually answering your question. And so I literally just launched this today. And so because I launched this today, I'm doing a founding member price too. So it's only for the first 10 members. So it's for the first 10 members only, it's $9 a month, or $49 for the whole year. So think about like the cost of a psychiatrist, which is like, $500 an hour, right? So dirt cheap to get psychiatric information and advice, right? For a lot cheaper than going to someone. So definitely look into that. Literally just launched it today. And if you want to be a founding member for the first 10 members, the link is in my bio. And literally think of it like Netflix, except for mental health. Okay, ADHD versus bipolar disorder. And here's how you can tell the difference. So, ADHD and bipolar, they look similar on the surface, but they can both involve mood swings, impulsivity, restlessness, and focusing issues, but they are completely different. And so they have completely different treatments too. And oftentimes these two can get misdiagnosed a lot, which leads to the wrong meds, and that can make things a lot worse. Like for example, there's more of a bipolar case that I won't forget, but essentially the bipolar person got diagnosed and they got put on lithium, and then they actually lost their thyroid from the lithium. And I assessed the patient, and I was like, this was 20 years later. And I assessed the patient, and I was like, hey, I don't even think you have bipolar. And the patient was like, yeah, I agree. I just got put on this and I kept taking it. So definitely a huge problem, right? A misdiagnosis. And it can be a problem with ADHD and bipolar, because if a bipolar person takes stimulants, that could precipitate them into a manic episode. And if an ADHD, excuse me, if an ADHD person takes mood stabilizer, that's like a powerful med that they don't need. So that's why it's important. So think about ADHD. So ADHD is more of a consistent pattern of distractibility, impulsivity, hyperactivity, and it's there all the time, not just in episodes. Whereas bipolar is more episodic. So that's where you'd have periods of depression and then periods of mania or hypomania, which are different from a person's baseline, but they're episodic. They're not like all the time happening. So I think about it like bipolar, right? You have euthymic mood, which is like a normal neutral mood. Then you have depressed phases, and then you might have a normal neutral mood, and then you might have a manic or a hypomanic phase, and then normal neutral mood, or like you go from hypomanic to depressed phase, right? You have these three discrete phases, whereas in ADHD, you might have a lot of those struggles like just throughout the day continuously. So, if you're dealing more with ADHD, you're likely to have, difficulty focusing in multiple settings like school, home, or work, fidgeting, impulsive decisions, losing items, zoning out, right? Even when you're not stressed, trouble finishing tasks or following through. Uh, Generally, the symptoms start pretty early, so before age 12. So oftentimes, I'll ask patients like, what did you notice when you were a kid? Like, did people say you got distracted, or did teachers say you were moving around a lot? Did you have trouble with homework and things? And patients, I will say like, yeah, the teacher would put me in timeout because I couldn't sit still, or I was always the talkative one, or the class clown in class, or like I remember always having trouble sitting down and just doing work, and everyone else in my class was able to do it. Uh, the mood swings with ADHD are fast and reactive, like they're moment to moment, and they don't last days, right? And this has to do with the impulsivity associated with ADHD. Whereas it's more bipolar if it's like we consider a true mood episode. So the symptoms will last days or weeks, not just hours. And so that's where you can have the manic or hypomanic symptoms of periods of high energy, less sleep need, racing thoughts, increased confidence or risky behavior, depressive episodes that can be disabling or cyclical, family history of bipolar disorder, and you may feel like a different person during an episode. So there's some overlap so that can confuse people. So they both can have racing thoughts, they both can have poor concentration, they both can cause irritability, and they both can lead to relationship or work problems. So, there's definitely some overlap, right? Especially these racing thoughts, the irritability, right? So that's what can get people confused. But think of it like ADHD is more consistent day to day, whereas bipolar is more episodic. Like it's clear, like there's before, during, and after phases. So, definitely be aware of a misdiagnosis, right? So, because of the emotional reactivity, that's the most common reason. Um, some people with bipolar, they can also get misdiagnosed because they only seek help during their up and down phases too. So that's key, right? They only seek help when things are really bad. So definitely it's important that you get the diagnosis right if you're seeking things out. So yeah, because then you can have the wrong treatment. But remember, you can also have both too, right? Usually I'll say like, both of these are issues with the brain. So if there's one problem with the brain, likely there's another too. So usually you want to treat bipolar first, and then because to mood stabilize you, and then you go about the ADHD treatment. So how I can tell the difference, how your doctor is able to tell the difference, right? Is the timeline of symptoms, the duration of mood changes, your family history, how your sleep pattern changes, any kind of substance use you might history, right? Because sometimes some of these symptoms can be tied to substance use. And you can do clinical interview, right? I mean, the clinical interviews, but also specific rating scales too. And those rating scales will look at the symptoms in more detail. So, basically, if you want to really maximize talking when you talk to your doc, right? So talk about your mood changes, like are they brief versus long lasting? Because that will cue them in, right? How have your symptoms been, especially since childhood or not? How you feel? Um, like, do you feel like a completely different person during certain phases, or it's more like you feel this way all the time? And if you notice your symptoms come and go in cycles, right? These are good insights you can have into your symptoms, and that can help cue your doc into the right diagnosis. So, they're both treatable conditions, right? They just have to be diagnosed correctly. So this can help you decide, between one way or the other, and then bring this up to your doc so that way they can really sort through and then get you the right treatment that you need. Spot on. I'm bipolar 1 and ADHD diagnosed later in life after manic episode. You just explained my life. Oh, yeah, yeah, precisely, precisely. I'm going to screenshot that. Exactly, right? So that's the thing here, is that so like, you know, a lot of patients get confused between bipolar and ADHD, and a lot of providers too. So definitely really important to be acknowledging this and knowing that difference. So I talk about all this in my new coaching program, Level Up Psych Library. Basically, it's like Netflix for mental health, and that's where I'm making all these lectures for. So it's really designed to help patients understand their mental health way better. That's the target audience um, for it, right? And so right now, right, we literally just started it today. So if you have learned from me, right, you want to continue learning from me, like this is the best place to do it. You can ask me questions directly. You have a community where you can discuss this stuff with other people, right? Meet other people who are going through similar stuff right you, like find out what worked for them, um, and literally just get access to the library of all my like knowledge and teachings on mental health for you to access whenever. And so literally just started it. So now it's the cheapest price it's going to be. It's like Netflix for mental health. I say it's $9 a month, or $49 for the whole year. And as going to a psychiatrist is going to charge you like $500 an hour, or you have to wait months in line for a wait list. So definitely look at that if you want to really take charge of your own mental health and you want to save time not trying different meds out, like just knowing what might be the right choice for you. And if you want to save money, instead of like wasting dollars on therapists and doctors who might not even like know you better than you know yourself. So that's in my bio. So that I would definitely check that out if you're serious about like learning about your own mental health. Okay, what to do if your antidepressant is causing weight gain? So some antidepressants, they can really affect your appetite, cravings, and metabolism. So they can increase your hunger signals. They can reduce your fullness or lead your to emotional eating by dulling your reward system too. So this is definitely a thing. Like you're not just imagining it. It's a very well known side effect of these meds. So luckily, we know which ones are more likely and less likely. So the ones that are more likely to cause weight gain are mirtazapine or Remeron, paroxetine or Paxil, amitriptyline or nortriptyline, the tricyclics, SSRIs like Zoloft and Citalopram, especially after 6 months, SNRIs like Effexor or venlafaxine. These are a little bit more likely. Some of the lesser likely ones are bupropion, so Wellbutrin, Prozac, it tends to be more activating, Vilazodone or Vibrade, Vortioxetine or Trintellix. These two are more like specialty SSRIs, and so they can target the serotonin receptors more in detail, and so that helps to reduce the weight gain. And Lexapro as well tends to be on the lesser side. So if weight gain is happening, so definitely don't panic. It's a common thing and it's often reversible too. So what you want to do is you want to just track it. Just make sure that it's not just imagining, but start tracking your weight, start tracking your appetite and your cravings for a couple weeks. You can switch to a lower risk med, so bring it up with your doc, right? If it's a big thing that you're noticing, or you can also combine it with a weight neutral or a weight negative med. For example, bupropion. You can rule out other causes like thyroid issues, sleep issues, um, birth control issues, emotional eating, right? Because that could be contributing as well too, right? So you don't want to ignore that. And I'm gonna add in metformin or GLP one agonist, such as like Wegovy, Ozempic, Zepbound, etc. So you can definitely discuss that with your doc too. This is becoming more of a common practice to do this. So there's definitely no shame in incorporating any of this. So there's some lifestyle tips that definitely can help, right? So eating more protein and fiber, so that can help with the fullness, right? Because remember, the tip that I tell patients is that, it can definitely increase your appetite and things, but ultimately you're the one who, will put food in your mouth, right? So what we want to do is we want to make it as easy as possible to avoid putting the foods that will cause weight gain, and to make it as easy as possible to avoid the weight gain as possible, right? We want to lower any kind of binging risk, so regular meals can help. Regular meals of protein and fiber, right? So there's stuff that's more filling. Walks after meals, that helps with insulin sensitivity, so that can help your body process foods as well too, and increase your metabolism rather than just storing it as fat. Making sure to prioritize sleep. Like this one's so key. The more the more better sleep you get, the less cravings you have, and your metabolism is better. Like I remember there's a day that I'll never forget. Basically, there was a night I was in my fellowship training. I didn't get good sleep. I remember going to work the next day, and I'm with my co-fellow, and all of a sudden I just have this craving for Chinese food. And I asked her, I'm like, hey, do you want some Chinese food? And she's like, yeah. So we DoorDash some Chinese food, and it arrives, and we eat it. But then afterwards, I was like, this is weird. Like, I never crave Chinese food. Like, never. Why was I craving Chinese food that day? And and I was craving like fried rice and lao mein and stuff. And I realized that, oh, it's because I didn't sleep well last night. That's why. Strength training twice a week. So strength training is really helpful because you builds lean muscle, and lean muscle, it burns fat just on its own. So I'll say is metabolically active. And so this is important because, so let's say you have a person who 150-pound person who burns 2,000 calories per day, right? So now let's say if that 150-pound person, let's say there's 250-pound people and they're twins, but one of them is more fat, 150 pounds, and the other is more muscular, 150 pounds. That 150 pound who's more muscular is going to be burning 2,200 calories per day instead of 2,000. And the reason is because muscle tissue is active, and just it existing burns more calories. So you raise your metabolism just by purely having more muscle. So it really does make a difference. And also say, don't buy junk or snack foods once it runs out. Control your environment to eliminate as many bad foods as you can. So this one's such a key point. Like for me, this is big because I like dessert a lot, and so I remember like before every meal or after every meal, I would always have a dessert like ice cream or chocolate or something, and it was harder for me to lose weight and to get lean because I was like this was just extra calories that I was adding on, and then I started substituting it for Greek yogurt and protein powder, and then like berries, and so now I don't even eat that stuff anymore, barely, because I just don't even have it in the house. Like I literally, the only junk food that I have in my house is protein bars, like the only kind of dessert food. And so now like that helps because I literally just don't even have access to it. So definitely consider that too. Just don't let it into your house to help your environment out. Because then that way you don't rely on willpower all the time. Willpower is a very finite resource, so it runs out, and especially runs out as the course of the day goes on. So that's why a lot of people binge eat at night, because that's when they lose all their willpower. So, if you want to talk to your doc about it, right, about weight gain, so you can add, okay, is there another med we can try that's less likely to cause weight gain? Can we add Wellbutrin to balance this out? Finding out more info. I've noticed my hunger has changed. Is this related to this med? I want to stay on this med, but can we create a plan to manage the weight part, right? So this is where either lifestyle plan or adding in metformin or the GLP-1 agonist can be thing. I'll even add that. Yeah, is there another, let's see, can we add Wellbutrin or metformin or GLP-1 agonist to balance this out. So should you stop your med because of weight gain? So you definitely should not, right? Because remember, there's a reason that you got on it, and that was to help your mental health. Uh, so, but if the weight gain is significant, right, and it's important to you, then it's okay to bring it up. And like, you definitely want to feel good in your body and in your mind, right? And you want to create a plan to address it. But, you don't want to stop it immediately because of withdrawal. So that's important. So, just remember that weight gain, it doesn't mean that the med is bad. It's a side effect that's associated with many psych meds. Um, so definitely like take an active role in it, do what you can, and yeah, work together with your provider as a team to address it. Advice on binge eating. Yep, I literally just talked about that. No, I definitely don't like Chinese food. And drinking foods makes it less filling. That's the downside of it. So I quit CA, now doing MBA, feeling so demotivated. Definitely feel motivated. Think about your future and what you want from it. And weight gain. Lorazepam's the worst. Yeah, it is the worst. Yeah. Did my mom make seasoned salmon today? No, we had seasoned chicken. We had lemon chicken, lemon and garlic chicken with broccoli. That was the vibe today. But they're off at yoga class right now. MAOI is very rare. Yeah, we don't really use them anymore. Do I have dry eyes? I do. Yeah, unfortunately, but is what it is. Okay, so how to know if you actually have anxiety, depression, or both? So, because they often overlap and they go together and they're often treated the same, like with an SSRI, but they're very different. So, knowing which one you're experiencing will help you find the right treatment, medication, and the therapy strategies. So, the core features of depression are low energy and motivation, feeling numb, sad, or emotionally flat, a loss of interest in things that you used to enjoy, any kind of sleep problems, like usually oversleeping, appetite changes, often eating less, thoughts of hopelessness, guilt, or feeling like a burden, and everything kind of feels like a chore, even the basics. But core features of anxiety are constant worry or racing thoughts, physical tension, right? Tight chest, jaw clenching, muscle pain, panic or fear when nothing's wrong, overthinking conversations, trouble falling or staying asleep, right? Because your brain's overactive, avoiding situations that might trigger stress, and restlessness, where you can't sit still or you feel unsettled. Can't sit still or feel settled. Yeah. So, how to tell if you have both, right? So you might feel exhausted and tired, or exhausted and wired, sorry. So anxiety can make you feel wired, and depression can make you feel tired. So they can kind of like go together. Anxiety could also make you feel tired from just like your mind racing a lot. You worry a lot, but you also feel flat or numb. You want to do things, but you can't get started, right? Often from feeling overwhelmed. You might go from panicking a lot to shutting down. You might cry easily one day and feel disconnected the next day. And so it's easy to confuse them because They both affect sleep and concentration. They both cause irritability and withdrawal. They both can lead to physical symptoms like fatigue, headaches, appetite changes, and they can often trigger another too. So for example, if I'm working with patients, then a big thing I try to figure out is, okay, did anxiety cause the depression, or did the depression cause the anxiety? It's a very subtle thing, but it really helps because then I know what to target, like underlying, right? So if someone's constantly worrying, they might just stress themselves out, that they start feeling burnt out, start feeling depressed. Their mind just kind of like gives out and just says it poops out, just says screw this, right? Or they're just like so low from something that's happening, then that causes them to start worrying about stuff, because they're like, wow, I'm not fulfilling my obligations. What am I going to do? I'm useless at work, and etc. So, looking for which one started first, looking at symptom, doctors will look for that. They'll look for the type of symptoms, right? Emotional flatness, which is worrying about the future, right? Physical cues, sluggish versus a keyed up nervous system, right? So this is more depressive, more anxiety, right? Is if there's any kind of pattern to their highs or lows, um, which one's getting in the way of your functioning, because that's what ultimately matters, right? Like everyone has mental health symptoms to some degree, but what matters is the functioning. Like, how does this impact your life? So the treatment differences, right? So they both use SSRIs, but depression therapy is more focused on activation, rethinking some of the thoughts, reframing it. Anxiety has similar CBT, but I might focus on different kind of thoughts, focusing on grounding. Might use beta blockers or hydroxyzine. Right. So here I'll add, okay, Wellbutrin. And then, both might use a combination of meds and therapy, right? With attention to pacing. Basically, I don't want to push it too hard or too fast. And, prioritizing one versus another, right? So that's why it's key to really know which one we're dealing with. So, pro tips for talking to your doc. So just understand that both depression and anxiety can coexist. So you can try to help clarify for them as much as possible, right? You could say, right, I'm not just sad, I feel physically anxious all day. I can't get out of bed and I'm overthinking everything. I don't know if I'm burnt out or something else. Can we talk it through, right? What would treatment look like if it's both? Essentially, because sharing that you are aware as well that it could be both of those things. So overall, very common to have both, right? So the key is to be clear on what's happening in your body, so that way you can get the help that you need and feel like yourself. Okay. So that one I'm going to call anxiety versus depression. Okay, so how long do antidepressants take to work, and what's normal with this? So here's what to expect, so that way you don't give up too early. So basically, this is important because they take about 4 to 6 weeks to reach their full effect. So oftentimes I've had so many patients say that this med didn't work for me, when it turns out they only tried it for like a week. So typically people start noticing changes within 1 to 2 weeks, but they're more subtle changes. It's not like you notice a big change. So I'll say usually 10 to 20% improvement. So not big, but not insignificant. So keeping signs of the early signs that it's starting to work, so that one could be you're sleeping slightly better, you feel less reactive or edgy, you're crying less often, you're less overwhelmed by daily life, right? It's not noticing that if things are gone or not gone, but it's stuff is just trending downward, happening less over time. So full improvement, right? This can feel like you have more energy and motivation to do basic things. You have more interest in people or activities. You have less brain fog or indecisiveness. You have less emotional reactivity, right? Like less snapping or spiraling out of people, spiraling out of things. And negative thoughts can still happen, but they don't really control you. So that's the key. So why does it take so long? It's because remember that antidepressants don't really work like painkillers. So they will gradually change your brain chemistry, and they gradually alter your receptors and some of the connections between the neurons, and it takes time to do that. So for example, SSRIs increase serotonin, but over time they can also cause increased neuroplasticity too, meaning that it's like the wiring between your neurons, so it can wire different connections. So like let's say you have some depressive connections that are wired, right? It can help reshape that. So basically, like let's say you start thinking a lot of negative thoughts, it can rewire those. It can neuroplasticity, or like your neurons are kind of wired to think that way, so that way that thought repeats over and over again, because remember, it's simpler for your brain and your body to do what it's used to. It takes less energy to do the same thing rather than to change to something else. But then if you have increased neuroplasticity, your brain is more less locked into the same thought patterns, and it's more able to adjust thing. Is more flexible. So because by becoming more flexible, you can have new thought patterns, new uh, improvements in your depressive mood, and like that can stick over time once you like localize those. So you can feel worse in the beginning. That's pretty common. So it's called the activation period. It usually passes. But it is worth knowing that. So oftentimes I'll tell people to start at a lower dose, or to use something like hydroxyzine or propranolol to help increase some of that initial activation anxiety. But usually, starting low and going slow is the optimal move, and just knowing that this is an expected thing. So, if you should definitely talk to your doc about switching, is if you feel zero change after 6 weeks at a therapeutic dose. So this is the key here, at a therapeutic dose. Oftentimes people just don't get to a high enough dose with depression treatment. If side effects are intense and they're not improving, if you feel emotionally blunted or disconnected long term, and if your mood or anxiety gets worse over time. So all of these are definitely worth talking to your doc about, right? Red flags you want to watch out for. So if you have any kind of harmful thoughts that get worse, so remember that oftentimes, your underlying depressive illness may have these kind of thoughts, but especially in people less than 25, there is some thought that it can worsen some of these thoughts. So you definitely just need to be aware of that. And, so it's a toss up, right? What came first, chicken or the egg? But if you notice like a significant worsening that feels different than your normal, and it's like lasting a while, then that's something to be aware of. If you have agitation or aggression, right, be aware of that too. Significant insomnia, right, because we want you to be able to get good sleep, so that way you can recover. And if you feel like a different person in a bad way, for example, like you feel some like numb, or you feel totally zombied out and it doesn't go away. So, what you want to talk to your doc about. So, right, for example, you can say, hey, it's been 4 weeks. I feel a little better. Is that expected? I'm not sure if this med is helping, or we give me more time. Would a dosage adjustment help before we switch together, right? So that way you're kind of advocating, and you understand that, hey, it might take a little bit more than expected. And what are the signs that tell you that a med is working? What should I be looking for? So just recognize the wait can be frustrating, right? But it's worth it, especially once things stabilize and get better. Because plenty of people will say, right, it's changed my life. You just have to stick with it. Like I remember this case, I had an OCD treatment resistant case. The kids tried, a 21-year-old kid, he tried a bunch of different meds in the past. But the problem we ran into is, like, even when I would try stuff with him, like he would try it for a week or two, then he would give up because he had OCD and ADHD. And so it was really, really frustrating to treat him, but also for him too. Like he felt that way. He's like, man, nothing's working. I'm hopeless. Like I'm never going to get better. And we were finally just able to convince him that, okay, let's do Zoloft. I know you tried it before as a teen, but it's really good for OCD. Just stick with it. And I talked to him a little bit later, and it's like 6 weeks later, and he comes in the appointment and he's smiling, and he's saying like, I'm like, wow, like you're smiling a lot, and he's like, yeah, like my brain finally feels calm for the first time, and so I was like, oh, sweet. Because like that was the first time he'd actually stuck with it for that long, and he was on a therapeutic dose. He was on 150 milligrams, so it definitely can work. You just have to give it often time and patience. Yeah. So yeah, that's the main thing to remember. But yeah, yeah, I don't think I have anything to add. Mm, OCD, what to take? You want to take high dose SSRIs. That's the key thing to take for OCD. Maybe we could get some light in here. I might make this. Just curious how it would look if I got my influencer light going. Ooh, damn, that's bright. And we've been live for 71 minutes too. Uh, Okay, so here's why SSRIs can make anxiety worse at first and how to handle it. So, like, this is definitely a real thing, and it's manageable, but it's definitely real. So, this happens because SSRIs like Lexapro, Zoloft, and Prozac, so they increase serotonin in the brain, but it's not like in a smooth, immediate way. So it can sometimes be jarring, right? Like sometimes it can be like a little spike, and so it's a sudden change, right? So it can overstimulate a lot of different brain receptors, and that's what can increase anxiety, agitation, restlessness, or even insomnia. So basically, like the SSRIs, like so they'll flood serotonin in the brain, right? They prevent its basically its reuptake, so then you have more serotonin. But then, so remember, like serotonin on its own tends to be more calming and stuff, but everything's in a spectrum in the brain, right? So just like we want your brain to be more calming, but we also want it to be activated too. And there's certain receptors that can be more activating or even promote anxiety because we want anxiety in real life. You don't want to have no anxiety. So it's like all these like sudden changes that can cause some of that worsening anxiety. So it's like an activation phase. Basically, it can last about 1 to 2 weeks. And then usually, like, the brain, it does what's called homeostasis. So it starts balancing out. So it adapts. So it's definitely a normal adjustment period, but it's important to know that. So some people might report like racing thoughts or intrusive worries. They might report restlessness or agitation. They might feel on edge or overstimulated. They might have trouble falling or staying asleep. They might have an increased heart rate or shakiness, and they might worry that the med is making things worse. So the way to reduce these, right? So it's to start low and go slow, right? So, it's using 5 milligrams of Lexapro instead of 10 or even 2.5. Taking it with food, if that upsets your stomach, that also taking it with food slows down the absorption of the medication, so it can make it more of a gradual absorption and a gradual effect. Take it in the morning if it causes insomnia. Take it at night if it makes you drowsy. These are just basically just things you can do to counteract some of the early activation side effects. And you can also use temporary supports like hydroxyzine, beta blockers. Um, uh, Yeah, so instead of beta blockers, mainly it's propranolol or a low dose benzo. If your doctor recommends it, so because that can really help people get through that initial phase. So lifestyle stuff, right? Avoiding caffeine, especially because if you have worsening anxiety and the med's more activating than you take caffeine, it can really be stimulating. You can get more movement or short walks to burn off some of that physical restlessness. You can do deep breathing, grounding exercises, or guided meditations, and just reassuring yourself, okay, like this is temporary, my brain's adjusting, like this is working, I'm noticing something, right? So just what you tell yourself makes a huge difference. The placebo effect's a real thing in psychiatry, and the expectation effect is real. So if you expect to get better, then you will get better. uh, when should you be concerned, right? So if you feel much worse by day 5 or 7, like way, way, way worse, like it's not a small thing. If you're having panic attacks daily that weren't happening before, like I've heard people say that. Um, if you have severe harmful thoughts, right? Significant insomnia, you feel disconnected, numbed out, uh, then that's when you might need to adjust it a little bit, like if you have significant dissociation too. So you definitely want to talk to your doc about it, right? Is this increased anxiety part of the adjustment period? Can we try a lower starting dose and build up? Could we use something short term to help with the first week or two? When should I expect this feeling to pass? So, right, see here, now you're being an active participant and you're doing something to advocate for yourself too, which one, could result in have a different result, right? So having a lower starting dose or, using something short term. But also, I think just the act of you being more aware, more active is going to help in your recovery as well too. You're going to feel more proactive rather than having stuff just happen to you. But overall, it's a well-known part of SSRI treatment, right? So worst things that we can do is just quit too early, just stick with it. You'll definitely get better within a few weeks. And, the worst thing is that if that doesn't work, then there's a whole bunch of other options too that you can try, not just the one thing that you're doing. Da 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 da. Yeah, nice. Yeah, so these are all good questions actually for my for our new community. So I have a new community called Mental Health or Level Up Psych Library, and like these are literally the type of questions where you can ask because I'm making all these courses and like all this info for that library itself too. Uh, so yeah, I would definitely check that out. Okay, how to advocate for yourself in a 15-minute psychiatry appointment. So oftentimes, people say that like their psych appointments are too short and they didn't get to discuss what they wanted to. They might say, "Hey, like I just got talked to the psych for 10 minutes and then they just changed up my med and that was it." So patients walk away feeling unheard, confused, unsure of what happened. They're not even sure if the med they're on is right because they didn't go through it, discussion with them, right? So if that's your situation, like just you can have a little bit of strategy going in, so that way you know what to expect and how to behave and like how to approach the appointment, so that way you can get all your questions answered and all the symptoms addressed and your voice heard, even if it's in a tight window. So like here's exactly what to do. So you want to prepare ahead of time, right? Write down what your goals are, the one or two top goals for the appointment. You may not be able to cover everything, so you may have to like prioritize, okay, like these are the one, two things I want to cover. Bring a list already of your current meds and doses, your supplements. Already have that on hand, so that way your doc doesn't have to kind of go through them with you and waste time when you just already have it already. Have already tracked your mood, sleep, energy, and anxiety for the past couple weeks. So this way, instead of you kind of thinking on the spot, like you already know, like you're like, okay, my anxiety was worse, but my energy was better or whatever. And then know if there's any new symptoms, worsening symptoms, distressing symptoms that you want to cover, have that there too. Basically, be prepared ahead of time. That's the key. Start with whatever is like your biggest priority, right? So you can even say like, I know time is short. Here's what I really need help with today. So that's huge, because then it'll help your doc prioritize as well too. Because like they're just going to be asking you questions, try to figure out what your priority is, right? So example, I've been on Lexapro for 6 weeks. I'm still anxious now, gaining weight. Is that normal? Tells them exactly where to focus, right? So that way they can go to where your concerns are. So that'll make a difference too. Step three is to use bullet points and long stories. So any provider or doc can tell you, there's like, we encounter lots of patients who are very verbose and they might just talk and talk, which is honestly like, I mean, sure, it can get annoying as a provider, but honestly, it can hurt you as well too. Because if you don't do that, if you are one of those types, like who's just more verbose and talkative, you might not get all your concerns answered because they might not be too nice to not interrupt you, right? So you want to be efficient, right? So depression's better, but I'm still waking anxious. Side effects are mostly gone, except I'm still super tired. So boom, right? You are lasering in on exactly what you want covered. So this can really help. You want to ask direct questions too. I think sometimes patients can get intimidated by doctors, or they feel like, okay, the doctors might think it's a dumb question, or they might not listen. So that's where the direct questions can be very helpful. So, for example, what's our plan if this med doesn't work? Is it too soon to adjust? Are there other meds with fewer sexual side effects? How do you decide when to switch versus stay? Right? Just being a little bit more direct can also help you in a short time limited appointment. And also, you want to make sure that whenever you have the plan is, you can repeat back to it. This is a classic strategy we are taught in healthcare. It's called closed loop communication. Basically, like, let's say I give an order to a nurse, they'll repeat it back to me. That way, I know that I gave the order correctly and they received the order correctly. So, you say, I'm staying on 10 million for 2 more weeks, then we'll reassess, right? You're adding Wellbutrin to help with motivation. Is that right? Right? So that way you feel more like you're part of the team, because, it's a team, like you guys are working together, and more importantly, you actually understand what's going on. You don't leave confused. So, bring in notes or a symptom tracker if you get anxious. Use the portal to message your doc with follow-up questions. If you feel rushed or dismissed, it's okay to say, I like, really understand why you're choosing this med, right? So you can say that, like, I'd like to understand why X or Y reasons. I'd like to make sure I'm clear on whatever it might be, right? And also just remember, if sometimes it's not a good fit, it's okay to switch, right? I've had plenty of times where I've had patients who've requested a switch from me because it wasn't the right fit. And that's perfectly normal. It's not something that I take personally. It's like, it's part of the game, right? So especially in psych, it's a lot more important than it is with other specialties. So overall, you don't really need to be aggressive to advocate yourself. You just want to come in clear and prepared, so that way, you know what your symptoms are, your goals are. That way you can approach each interaction more efficiently and use your time as wisely and as best as possible, right? Because remember, ultimately, it's about you and your brand and how your treatment's going to go. How would you advise a family that's all messed up? Yeah, sometimes in the families, I have to tell like the mom or dad to leave and then talk to the kid alone. Okay, so those are all the videos that I've uploaded or I need to record for today. And so what I'm going to do now is I'm going to upload them into my program. So again, this is Level Up Psych library. And so it's just for patients who really want to understand their mental health and want to level up, their mental health knowledge more. And so right now there's a founding member price to us. So that was the cheapest it's ever going to be because I literally just started it today. So now is the time that you want to join rather than later, right? If you're a patient who's really seriously likes learning from me. And I think the best kind of person would be like if you're in this live right now, because like you clearly like, obviously you get some kind of value out of this, right? And out of the information and knowledge I share. So it's pretty much all of this in a much more detailed format. And you can ask me questions more directly, and I'll respond to your concerns. I'll make videos responding to your concerns in much more detail than I can on this live. So if you're interested in that, interested in like having like a library for mental health, basically any kind of concern you have, you can look it up in the library taught by me. And also, if you want a community and be able to connect with other people, then that's who I recommend that for. So yeah, and hope to see you inside. Otherwise, I'm going to put all these modules that I made into the program. And yeah, I will see you soon.